morning. We are from Group E. So we will present about traumatic tympanic membrane perforation. So this is table of content. Okay, this is a normal tympanic membrane, which the function is to transmit the sound to the inner ear. So tympanic membrane perforation, there is two types, which is central perforation, which means perforation in pars densa, not involving the annulus. Or marginal perforation is a perforation of pars densa involving the annulus.
So I'll be talking about the importance of functions of tympanic membrane. So firstly, I'll be explaining about the physiology of sound transmission. So sound waves hit the pinna and then travel through the external auditory canal or the meatus and cause vibration of the tympanic membrane as seen in the GIF shown. This transmission or vibration on the tympanic membrane will then get transmitted to the ossicles, which are the malleus, incus, and the stapes, and then to the oval window through the oval window to the perilimb, and then to the round window for the cochlea for nerve transmission. Another function will be for amplification by vibration when the tympanic membrane is hit by the sound waves, and therefore 20 times amplification by the ossicles. So the causes of traumatic tympanic membrane perforation will be insertion of objects into the ear canal, for example, cotton swabs purposely or accidentally, which can cause perforation through trauma into the tympanic membrane. Another cause will be like concussion by an explosion or open-handed slap across the ear, or any head trauma such as temporal bone fracture. Therefore, any trauma or shear forces in the region of the ear can cause tympanic membrane traumatic perforation. Other than that, sudden negative pressure, such as strong suction applied to the ear canal, can also cause the traumatic tympanic membrane perforation. Scuba diving or during air travel, which causes barotrauma due to the differences in air pressure, can cause retraction due to the negative pressure in the middle ear, or bulging of the tympanic membrane outwards, and therefore its shear pressure can cause perforation and therefore trauma for the tympanic membrane. Other than that, iatrogenic perforation from instrumentation, such as during CERAMENT cleaning or any other ENT procedures, can also cause accidental trauma and therefore cause perforation of the tympanic membrane.
So to diagnose the perforation tympanic membrane it is a clinical diagnosis. So from the history checking, the chief complaint would be hearing loss or ear pain after the trauma. It may be associated with blood stain, tinnitus, and rarely the patient will complain about vertigo and nystagmus. So from the physical examination, first we do the general examination. From the face, we see if there are any facial asymmetrical or sign of trauma, and from the external ear, we assess is there any ear discharge or swelling. Next, we do the otoscopic examination. From the external auditory canal, we see if there are any sign of inflammation or swelling or any ear discharge. Next, to assess the perforation of the membrane, we need to see if it is a central or marginal tympanic membrane perforation, the quadrant involvement, estimated percentage of the perforation, if there are any bleeding or blood clot, and the edges. So this is how we estimate the size of the perforation and the location. This is the example of the tympanic membrane perforation. Next, we do the hearing examination. First is Rini and Weber test. So for the tympanic membrane perforation, it is a conductive hearing loss, but it may be complicated with sensory neural hearing loss. Next is a free field test. And if the patient complains of vertigo and nystagmus, we should do a vestibular examination. And next one is facial nerve examination.
Moving on to treatment and management of the traumatic perforated tympanic membrane. The treatment and management mainly is supportive, and we will ask patient to keep the ear dry as much as possible, since it can predispose to the infection if the ear is wet. And we also will do the hearing assessment for the patient to determine the hearing level and also the type of the hearing loss. And we can also prescribe patient antibiotic ear drop, such as the ofloxacin if there's any presence of the infection. And we can also provide patient hearing aid if there's any permanent or sensory neural hearing loss. And we can also offer patient surgery, which is the myrincoplasty, which is the closure of the perforation of the pars densa of tympanic membrane. So the type of the graft material will be used during the surgery will be the temporalis fascia, which is the most common one, cartilage, fat graft, and also synthetic material. And the technique used during the surgery is either underlay or overlay or also inlay. So moving on to the complications. The complications will be the acute otitis media, ossicular discontinuity, perilimb fistula, and also permanent or sensory neural hearing loss. These are the references. That's all from us, Group E. Thank you very much.